Dr. Russell Libby, and I welcome you to the world of medicine. As you know, on this show, we learn about important topics, conditions in healthcare and medicine, from people like you and me in our studio audience, people who have lived through and currently live with conditions that are really important. Today we're going to talk about leukemia. Leukemia, of course, is a cancer that many people will hear about. Some will have friends, loved ones, family members, or even possibly themselves having been afflicted at one time or another. It's a very intense and very significant disease. We're going to hear some great stories from people about how they came to understand that they were sick, what it was, what they did about it, and the kinds of things it did to their lives, how it impacted the people they love, the work they do, and their outlook on the future. We have two excellent hematology oncology specialists with us. Dr. Robert Reid, he has a practice in Fair Oaks as well as in Woodbridge. He's an adult hematologist oncologist. Dr. Jay Greenberg is a pediatric hematologist oncologist, someone who I've relied upon for so many years to help me with my patients as a pediatrician here in Northern Virginia. He's now at Children's National Medical Center in Washington. So welcome, and I really thank you all for being here. It's a great honor to have people who feel that much about their background, about what they've been through, and are willing to come talk about it. First thing I want to know, actually, from those of you who have had or have a leukemia, exactly what your diagnosis was and what your current condition is and when it was diagnosed.
Hi, I'm Ron Bastion, a pediatrician who's had leukemia, diagnosed in April 2002, had a bone marrow transplant as well in January 2005, and I'm in remission currently.
Fantastic.
I'm Brian Tigner. I was diagnosed in 1996 when I was 10 years old. I had ALL and went through about 2 years of treatment, and then my younger brother, who was 4 at the time, was diagnosed, and so he went through his same amount of treatment, and then about 3 years after his treatment, he was actually diagnosed again. He relapsed, and so then he went through 2 more years of treatment.
So currently you're doing pretty well, and you're here representing you and your brother.
Yes.
Be an interesting story.
My name is Gail Scheller. I have a son, Christopher, who was diagnosed with leukemia at age 2. It was in 1996. He is now a 12-year-old and doing just wonderfully, and he was actually treated by Dr. Greenberg.
Oh, fantastic. Good. That's a good thing, because I know he does excellent work. And there we go.
I'm Jason Resto. I was diagnosed February 2nd, 2005 with leukemia ALL in northern Idaho while I was playing hockey, and I'm going on 3 years of chemotherapy, and I'm currently in maintenance.
Great, great. Well, we're going to hear a lot about how all these things evolved.
I'm Elaine Horsfield. I'm here representing my son who has ALL, Philadelphia chromosome positive. He's been through a stem cell transplant, relapsed after that, and is now been through radiation and is looking for clinical trials. He's on Sprycel at the moment.
Wow.
I'm Andrew Colletti, and I had acute biphenotypic leukemia with Philadelphia chromosome. I was diagnosed by Dr. Reid and treated, and then sent to Seattle for a bone marrow transplant, which I had in 2002. And I'm 5 years disease-free, and it's gone. I'm well.
All right, we're trusting that's true.
My name is Carl Kaufman, and about 3 years ago I was diagnosed with a blood cancer similar to leukemia, non-Hodgkin's lymphoma, follicular lymphoma. I was treated for it in November of 2005, and thankfully I am in remission.
Thankful is right. So, Dr. Reid, we have a number of adults, and leukemias come in a certain set of varieties. Tell us a little bit about what we see in the adult population.
Well, leukemia compared to solid tumors, much less common type of cancer, affecting on the order of tens of thousands of patients per year in the United States compared to some of the more common cancers like breast cancer approaching 200,000 cases per year, colon cancer 130, 140,000 cases. Of the acute leukemias in adults, more often they're of the myelocytic type, acute myelocytic leukemia we call AML, And then a smaller subset of adult acute leukemias are acute lymphocytic leukemia, typically a younger average age. So that's sort of the distribution. And the follicular lymphomas are ever actually increasing in incidence, or I should say non-Hodgkin's lymphomas. And of the non-Hodgkin's lymphomas, where the annual incidence is on the order of 50,000 patients per year in the U.S., the follicular lymphomas are upwards of a third of all the non-Hodgkin's lymphomas. And the non-Hodgkin's lymphomas are very diverse, 40 or 50 different types. Of the acute leukemias, if we talk about AML, or biphenotypic leukemia is a sort of a cross in terms of its origins between myelocytic and lymphocytic. These are two types of white blood cells in the immune system. Also, acute leukemias are very heterogeneous. When we first characterized them decades and centuries ago by looking at what they look like under the microscope, and more recently, their clinical behavior and prognosis is better described by their genetics, their chromosomes, and characteristic breaks in the chromosomes we call translocations and deletions. So the genetic makeup of leukemias is critical in understanding their prognosis and treatment.
And Dr. Greenberg, the pediatric leukemias generally tend to be less complicated?
A little less complicated, and it's important to emphasize that it's not just the same disease occurring in a young person. These are actually different diseases with different genetics, different treatments, and for the most part, different expected outcomes.
So when we talk about leukemias, obviously we're talking about the white blood cells and the impact that these different types of leukemias, the myelogous versus the lymphocytic, the difference in terms of how they affect white blood cells ultimately ends up being the same, very different. Is there a qualification for AML myelogous versus lymphocytic?
The question in terms of the impact on the patient?
Yes, and just in generally what happens so people understand what happens as you develop a cancer.
Okay. Well, in contrast to, let's say, breast cancer, where it often is localized to the breast organ, your immune system is pretty much everywhere in your body. We typically think of it mostly in the blood, but the immune cells are in most of the organs in the body. And the leukemias are very rapidly growing, so you can literally be a healthy marathon runner, and then a week or two or a month later you find that you don't have the endurance, you've developed fevers, you're suddenly having bone pain, and so it's a very rapid growing type of cancer that requires urgent treatment. The breast cancer is treated surgically. Leukemia, being a blood tumor, is not localized in a way that's addressed surgically. It's treated with medication.
So you were saying that people can be literally as active as running a marathon one week and the next week critically ill. And I think you more or less have had that kind of experience. Now, give us a little background. You said you were playing hockey in Idaho when you were diagnosed.
Yeah, I was in northern Idaho playing junior hockey when I was diagnosed. One night I was just watching TV with a couple of my roommates, and I just had a bad chest pain and lower back pain. I didn't know what it was, so I called my mother. She said take some Advil, put some ice on it, so I did that. Around 3 in the morning, it was bad. I was tearing up. It was terrible. So I told my roommate, take me to the hospital, and see if I could get some pain medication for it or see if something would help. And I went to the hospital. They took my blood, and they noticed something was wrong. They took it again, and they said you might have leukemia. And at that point, I didn't know what that was. I thought that was, I have a bad cold. But
it was supposed to be an itis, wasn't it?
Yeah. But then when they said cancer, I knew what that was because my mother went through breast cancer. So that's when it kind of hit me.
So you were alone. How old were you then?
18.
18. And you were a real athlete. I mean, hockey players have a very unique lifestyle, I have to say, especially those who aspire to play at higher levels. And I know you're here with a good friend who also was he with you at the time?
No, he was not.
No, I was not. I was still at home. I was playing locally around here still. Yeah. And I didn't find out until a couple of days afterwards when there was another one of our friends who was up there playing with him. And I was talking to him on the internet, and he said, Jason has leukemia. And so I was like him. I didn't know what that was really, and I didn't know the severity of it. And so I went running downstairs and I was like, Mom, Jason has leukemia. And so she kind of hit her right away because she's been through all that stuff before. She didn't have the cancer, but she's known people that have. And so it didn't really hit me until I talked to him on the phone that night, and I heard how bad he sounded, and it just made my heart sink to hear him like that.
Right. So you basically had absolutely nothing going on. Next day, that night, you were having back pain. You went to the hospital because it was like something you never experienced.
Well, that night in practice, actually, I didn't have such a good practice.
Yeah, I would imagine.
People were going by me, and I just wasn't doing well. My coach knew something was up, but he wasn't sure. So I went home thinking, just eat a good dinner and get some rest. And, I thought the pain was, I just got nailed in practice.
Right.
I just got hit real hard.
Yeah.
But that wasn't the case, and it was very shocking.
So when they said this to you, that it was a cancer, and it sort of scared you, but you had no idea what you were dealing with at that time?
No, not at the time. When I heard the word cancer, I knew more of what I was dealing with.
Right.
Because my mother went through the breast cancer, so I kind of knew how big that was.
Yeah, you weren't looking forward to it.
Absolutely not. I was just saying, well, can I go to practice tomorrow? Apparently, it turns out I couldn't.
But there is a good ending to the story. You're playing hockey now.
Yeah, and teaching and
you're
instructing.
teaching, and you're doing well.
Absolutely.
We're going to talk more about what happened to you, but you're his mom.
Yes, I'm his mom.
And you got that call sometime in the middle of the night. Of course, he's out there 2 time zones away.
Yes, 3,000 miles.
He's calling you at 11. It's 1 o'clock.
Mm-hmm.
And you said what?
And I just said, ice and Advil. A hockey mom just always goes for the ice and Advil.
Right, of course.
Yeah. And he called back later and said, Mom, it hurts real bad. So I said, get your roommate to take you to the hospital. I'm 3,000 miles away. There's not much I can do. So he called a little while later and said the doctor came in and said they've done a lot of blood work, but the blood was funny and it could be a number of things. And he rattled off 3 or 4 different things, and leukemia too. And I said, okay, Jace, we'll just wait a while. The doctor will come back and let you know. But I knew, being in the medical field, not as a nurse or a doctor, but just working for them for many years, that doctors do not drop that word lightly.
Right, sure.
So I went downstairs, got on the phone, called the ER, asked to speak with the doctor or the nurse in charge to get a first-hand update on what's going on. And he told me that they thought it was leukemia, but they were going to do another set of labs and possibly a bone marrow to get conclusive evidence. And I said, okay, go for it. But I said, could you please have someone call me? Because he was 18.
Sure, yeah.
And in the United States, when you're 18, they don't legally have to give Mom any information. And so the doctor was wonderful, absolutely wonderful. And they called me about 6 hours later, and I was at work. And they said that he was diagnosed with leukemia, ALL.
Right. And what happened to your heart when you really found that out?
Well, actually, I was kind of numb. I'm a 12-year breast cancer survivor right now. So fortunately, I knew of wonderful oncologists to call.
Great.
And it was at 8 o'clock at night, so that was my first call at 8 o'clock in the morning. My oncologist hooked me up with the leukemia doctor, head doctor there in Fairfax, and we talked. My husband and I flew to Idaho, and the doctors talked, and actually we packed for 2 days and ended up staying there a month because he was unable to travel.
Right. So he was pretty rapidly
He
progressing.
was a sick boy. Yes, he was. He had a lot of bags of drugs hung up on that.
Yeah.
But he's doing
pretty
good.
Scary stuff. And so we're talking about people in the midst of an incredibly active life. And I know that a little bit of your story. What happened with you?
Yeah, I was a triathlete, and 6 weeks after having my personal best, my health just totally collapsed. I presented, I guess, most significantly with a deep vein thrombosis. People who are in shape just don't get those. So it wasn't too long after that we went ahead and did blood tests, and it came back positive for biphenotypic leukemia.
Now, I have to ask you, I hear people around here say they're triathletes, and I wonder where they swim.
Well, I could only be a triathlete in the summer because I only had access to a pool. But I guess if you want to jump in a lake in the middle of January, you're welcome to do so.
Okay, so it's not like the Hawaiian one where you get to swim in the ocean.
No,
Okay,
I wasn't at
good.
that level.
All right, well, that's great. So you were pretty active, and then you had an unusual episode of pain in your leg.
Right, yes.
And that was diagnosed as basically a thromboembolism of some sort, some kind of venous
Right.
thrombosis.
Yes.
And as they did the evaluation, it became clear that there was some other process ongoing.
Yeah, I wasn't recovering well from that, and my wife is an oncology nurse who had transplant experience,
Right.
actually. And of course, well, her expertise was lymphoma, so she was sure I had lymphoma.
Right.
And she had the doctors figured out and all that. But she pressed a little bit with our physician, just trying to speed things up a little bit, and said, I'd really like to do cancer screening. So chest X-ray and more blood work, and that she called back the next day, and there you go.
Wow, amazing. And so you're saying that people can be very active one day and the progress of that disease can be extremely rapid. I know that you have a different story, but...
It has some similarities in that I also noticed exercise intolerance. I had been at the gym and I couldn't even pedal 2 minutes on a bicycle. I just thought it was seasonal allergies. An emergency room doctor, a friend of mine who worked next door, looked at me and said, "Ron, you look kind of pale." So my nurse drew a hemoglobin conveniently available, and she said, "Dr. Bashan, it's 5.7, which is very low." So I knew I was a sick puppy. And I was able to call my internist and have me evaluated in the ER very promptly.
So, well, first of all, I have to say that Dr. Bashan is a pediatrician like myself, and I never really, we never had a lot of professional time together, but we knew about each other. We actually gone to a pool again. We were too busy.
I was busy.
But nonetheless, I had heard that you got sick, and I heard a very devastating and rapid tale of a downhill trend. I heard from one of your kids who was trying to arrange to settle your estate because they were anticipating the worst.
Yes.
And this was several years ago, and I ran into Ron just a couple of weeks ago at the hospital, and I thought I must be in some dream state. Here he is in the flesh, and it was a great thing to see, and I'm really happy that you've survived this. But I guess because your tale takes you around the country, and you were away for a fair period of time.
Yes.
You're his wife,
Yes, Kathleen,
And-
his wife.
you've had to endure that awareness. Now, had you been aware of did you have any premonition something was wrong with him?
Actually, he was not really. No, not really. No, he was acting, I guess he didn't have as much energy.
Right.
But he had actually gained some weight, so we were thinking that it was related to that. So no other telltale signs, really.
Okay. And then, of course, he was the one who told you that something was going on like that. Did he call you from the ER and say?
Oh, yes, he called me from the ER and said, "I think you better come." And for Ron to say that, I knew something had to be serious.
Yeah. And I guess it really takes your knees out from under you when you hear something like that.
Oh, when you mean especially when we got the diagnosis? Oh yes, oh yes, and it was especially difficult for me because he was diagnosed, and it was exactly the age my own father had been diagnosed with leukemia. My father died of that.
Is that right?
And my mother was exactly the age I was, so at the time.
much a
So it was
coincidence,
a
yeah,
coincidence,
that's
no
for
genetic
sure.
connection,
Right.
but.
So for you at that time, it was bringing back a lot of very unpleasant thoughts and memories then.
Very unpleasant, and also a pessimism that right away I had because of the experience I had in the past, whereas my husband's very much the optimist.
And of course, here he is, the healer, becoming the patient.
Becoming the other side of the bed, yes.
It's an interesting place to go. And you were always an active one. And at the time of your diagnosis, what was your general state of health?
It was actually pretty well. I mean, I was 10 years old, so I mean, I was in doing PE, regular old things, playing on the playground. But I remember probably about a week before I was diagnosed, I think I did the most sit-ups in the class, for, so like, I mean, there was different signs, but I mean, I wasn't as active on the playground. I would sometimes just sit up against the wall and not really play or do anything. So my art teacher was actually the one who called my parents and said, something's definitely wrong. Like, I don't see him that often, but, you know, I can see that something's wrong. And so, I mean, I would walk to school every day, and sometimes I would barely be able to make it to school. And it's very strange. I mean,
So it was a little bit more of a gradual onset than some of the others we've heard about. Yeah. And what's typical for, I guess, the ALL? What is the most common kind of presentation that we're going to see?
Unfortunately, there is no typical. It's fairly nondescript symptoms, and people usually say take some Advil and maybe get some more sleep, and we'll see how you are next week. Unfortunately, they'll go into the physician's office with these nondescript complaints, and they'll be misdiagnosed because this is not the first thing a physician would think of until you do a blood test. And once the blood test is done, it's pretty obvious.
So we have bone pain, just aching in an unusual way, in an unusual spot, and more or less to the point of being excruciating rather than being your typical aches and pain that a hockey player might experience. We had a deep vein thrombosis, which is something that's fairly unique and something that you won't see that often, but when you do, it's something that brings up some pretty worrisome things. You had some experiences that were, I guess, a little different in terms of the way your child presented. Tell us a little bit about Christopher.
Well, Christopher, and looking back, Halloween was just a few weeks before his birthday, and he was a very active young man, but suddenly wanted to be carried everywhere. His second birthday, to the exact day, he was bending down opening some presents, and I just noted he had a line of 3 swollen lymph nodes on one side of his neck and the same exact thing on the other side. I was working as a pediatric nurse for a local pediatrician at the time and knew just enough about leukemia to be afraid of it. Started worrying a little bit, and he actually had a 2-year-old checkup later that week. And I called the office the next day and said, you need to see Chris sooner, you need to move him in. He went in for a checkup and really complete bill of health. Everything was wonderful. The following week we were out of town. He had some ear pain. He did have an episode of limping that he was also seen for. By the time we got into the office, he was running around. In the morning, he was limping for me and didn't want to put weight on his foot. Again, he was 2. He wasn't a real verbal little boy, so he couldn't tell you a lot about what was going on. And again, he had I know he was very well checked over. Everything was great. Coming back from Pennsylvania 2 weeks after his second birthday, I noticed that he was just very sluggish. He was very sleepy. We had an 8-hour car ride with all the traffic, and very abnormal for a 2-year-old to sit in his car seat and not be, straining to get out. Got home and I got him into his pajamas, and again, he was just so tired, and I thought his stomach just doesn't look right. It just felt like he had a little bit of swelling. So of course, put him to bed. It's a Sunday evening after a holiday weekend. Called all of the nurses that I work with to say, how do I know my son does not have leukemia? And of course, everyone said, nurses always think their children have crazy diseases.
The worst diseases possible, sure.
And again, my husband, my husband being an engineer really you're just overreacting. The next morning we woke up, and of course he's drinking, eating his breakfast, running around like a normal 2-year-old. And I said to my husband, you've got to bring him into the office today. You're the one who's working from home. You must bring him in. He has to be seen. And my husband, again, thought I was really overreacting. He looked wonderful. But when he came into the office and was checked out, first thing was, he had ear infections. It could be that. His spleen was a little enlarged. Maybe it was mono. And by the time they felt his liver and we did a hemoglobin, which again was very low, he was very anemic, it was honestly just a formality to have the blood sent over to the hospital and have a pathologist look at it. But it was, it was it's funny, the first couple weeks, it wasn't anything you could really pick up on. It was just a mother's intuition that something was wrong. Sure. And that last week, it just seemed like it snowballed.
Well, and I think that probably people have premonitions when they feel bad in ways they've never felt before. But they had a nice, I guess, variety of symptoms that that were more the traditional kind with the lymph nodes and maybe the sort of distended belly, a little fatigue, limping here and there. Those sort of, and the ear infections and just things that sometimes seem like, oh, they're part of being a kid. But when they all come together at one time, it's pretty disconcerting. So people get their diagnosis, and their families have to adjust, adapt, and I guess the real thing that must be really harder than anything is coming to terms with what you have to go through to get treated, to get your diagnosis and to get treated. What are some of the things that you remember most clearly about that process?
I remember getting my first bone marrow with my roommate. He stayed by my side until my parents got there. He was still in high school at the time, and he stayed with me, and I had my first bone marrow. I remember getting that and not feeling too well. Then my parents were on their way, and I remember waking up in the middle of the night, like a couple days later, just panicked. It's hit me.
Yeah.
I'm up, I know what's going on, and I don't like it.
I don't like it at all. How many bone marrows did you go through, or have you gone through?
9, 10.
Okay. They get any easier?
No. I woke up, and when it really hit me, about 4 or 5 nurses had to come in the room, and my roommate had to come in. I was just freaking out. I was throwing things. I didn't want this happening. All I wanted to do was play hockey and have fun.
Right.
That's it.
I can't blame you. That's devastating as a kid to come to terms with your mortality in such an acute and awful way. Did you have to come to terms with mortality in a similar sort of way? I mean, were you angry? I mean, it seems like that's a pretty good and normal reaction to have.
I think that is normal. You know, I think that if you could name an emotion, I probably had it, depending on how I felt that day and what was going on. When I was diagnosed, I had a daughter who was 2, and my wife was 9 months pregnant.
Wow.
And so at that point, I was 32, and I'm thinking, this is not, this wasn't really what I thought was in the cards for me, and it was very difficult. And there were some days that were good, and there were some days that were bad. And I think the most difficult part was the uncertainty, just not knowing, what is the way to do this. There are so many different ways to go through treatment. There are so many different ways to decide, how, when, things like that. And, obviously I've come to terms with it, and it's given me a new outlook on life. But at the time, it was very uncertain.
So people get this diagnosis based upon their blood, but you have to do some pretty invasive testing to find out exactly what it is. What are the kinds of things that you do with kids?
Well, you do the bone marrow test to actually make the diagnosis, but the treatment involves multiple spinal taps, as well as fairly intense chemotherapy. There are different phases of our treatment, and fortunately the initial phases in childhood leukemia are well tolerated, and then we lower the boom. And the second phase, which begins after we actually have control, is much more intensive, and that's the phase where patients really have to look into themselves to get through it, and the families look into themselves. And that's very difficult. Now, in treating young people, it's a very long process. The treatment is 2.5 years for girls and 3.5 years for boys. But fortunately, the last 2 years is pretty well tolerated. The kids are back in school, living a normal life, and just coming into the office if we're lucky.
And the adult population, it's a little different in terms of you do bone marrows, you do chest x-rays, CT scans, do you do things looking elsewhere for other kinds of problems?
Initially, if the suspicion from the physical exam, yes, we might do that. But for some of the leukemias, the genetic markers can be followed up by blood testing.
Right.
To determine ultimately the response after that initial induction course of chemotherapy. We have to repeat the bone marrow. And depending upon a physician's office, that can sometimes be done with a sedation with an anesthesiologist. I imagine you're doing that with kids.
We generally let the kids sleep through it.
Yeah. So for some of the leukemias, fortunately, we can do long-term follow-up testing, just drawing blood.
How does someone choose an oncologist? I mean, is it something that do you research it? Do you go on the internet and say, oh my God, I've got leukemia. I want to find the one person who's cured everybody they've ever encountered?
Well, I have an internist whom I trusted and referred me to a person who I thought would be reputable, and I took that recommendation. I trusted him, and actually, since he was an adult oncologist, I wouldn't know him as I might know Dr. Greenberg, for instance, having talked to him on the phone a few times in my practice. And I felt comfortable. I trusted the person. He had experience. He explained things empathetically, and so I felt I was in good hands. He had experience, and that's how it worked for me.
Right. And I guess that relationship with the doctor becomes very important, and I'm sure that for all of you, at some point or another, it gets to be a pretty emotional relationship, even as you have to make decisions, and sometimes news isn't good. Do you remember things that happened to you that really set you back in the process?
When I was neutropenic, when I had no immune system at all, I came down with Aspergillus pneumonia, and that felt like having a heart attack. I've never had one, but I thought I must be having one. In fact, they scrambled the nurses to that point. That was a key moment. I thought I was dying then. But I got good infectious disease docs that got me through that. And I actually almost forgot to mention it. It's almost an afterthought now.
So there were moments there. So I guess the neutropenia, when they start the treatment, one of the treatments is basically to wipe out all those cells that are leukemic, and in that process, they have to wipe out all the cells that are normal.
Right, which made me vulnerable to things like Aspergillus, which I guess we breathe it in every day, but when you have no immune system, it can take over, and that's what happened.
Yeah, no, if you go into a gym and you look up on the ceiling and you see that sort of grimy stuff up there, that's all Aspergillus, not a problem. Of course, you don't know that until you have to worry about it, right?
I still stay away from gyms.
Yeah. So that's why we like to swim in the fresh water outside now, probably pools, yes. I can imagine. So that was a very intense part of your whole process. Now, how many rounds of chemo did you have to go through? Did you have to go through, well, I guess they put you into remission.
Right. My first round of chemo failed to put me in remission.
Right.
And so Dr. Reid prescribed a much higher dose of I think it was called Hydac. It was whatever it was very nasty.
High dose cytarabine.
High dose cytarabine.
Mm-hmm.
Aracy. And that put me into a tentative remission. By that time, he had a very definite diagnosis that I had the Philadelphia chromosome and that I needed to pursue a bone marrow transplant.
So there was no way out with that Philadelphia chromosome?
There was no way out except to face the transplant and all the uncertainties that came with it.
There.
Right.
Yeah. And we're going to talk about bone marrow transplants in a minute, because those are so essential, it seems, in the whole opportunity to recover. Now, you haven't needed a bone marrow transplant. So we've been fortunate, but you've been through the chemotherapy and you've been through the side effects of the chemotherapy.
Yep.
And now you're pretty grateful that you're not doing it.
Yeah. I have an older brother and sister, and they were both tested to see if they were matches or not. And it turns out both of them are both identical matches. So if I did need one.
You were fortunate.
Yeah.
And you're fortunate thus far that it has not happened, and hopefully it won't.
Exactly.
And we have another interesting situation in terms of risk factors, which certainly are hard to figure out. But you were telling me about your brother also. And let me hear from your mom a little bit about how she perceived the whole thing. And you have one who's sitting here, he's a strapping young guy who seems to be pretty darn healthy, and that's a really great thing to see. But he was in the midst of his chemotherapy when you had a second child.
Right, with a different set of symptoms. He, we thought, was having sympathy pains because his brother had been undergoing treatment for, he was into the second year, and his brother had been watching him since he was 2, and he was now 4, and I guess he might sometimes gotten jealous of all the attention. So when he complained of his leg hurting, of course, the first thing that went through our minds, knowing the symptoms, was, oh no, no. And then I think my husband convinced me that it was, sympathy pains. But it went on for a few weeks, And the pediatrician said, fine, bring him in. I'll, make you feel better. So he took some blood, took an x-ray, and 5 o'clock that afternoon he called and said, I think you need to take him to Brian's oncologist, Dr. Greenberg, in the morning.
Yeah.
And so
the saga times 2. Wow, that's a tough sentence. And he's doing okay?
He's a freshman in high school.
And so these are pediatric ALLs, and you basically have done well without transplants.
Right.
Right.
Well, his younger brother relapsed,
Yes.
but it was such a late relapse that we did not do a transplant. And obviously, Brian was not going to be a match for him, or
Right, sure.
wasn't a good
Right.
candidate for transplant.
So we talk about bone marrow transplant, and Dr. Bashian, your story in terms of how that evolved for you, as you'd said, you'd gone through the induction several times. You thought you had a remission.
And the consolidation, yeah. Right.
So you were well for a year or so.
Right, that's correct.
And then what happened? You started to go downhill, and you
Yeah,
ended up back in the hospital.
Yeah, I have an interesting story from my colleagues. I'm sure they've seen something like this before. But I developed myelodysplasia, which is a sickness of the bone marrow that can occur independently or with leukemia after it, and gradually became transfusion dependent, saw several specialists and considered my options, and finally decided that a transplant would be worth looking into. So we went out to Seattle, the Fred Hutchinson Cancer Research Center, and they were willing to do this for me and then make a search for donors. And that's how that process began. I didn't have a matched donor, so I had to find an unmatched donor. Out of 5 million, I believe, in the data bank at that time, they found one that was an adequate match for me, and even that, not a perfect match. So we spent 4.5 months in Seattle, beginning early January 2005, preparing and then going in the hospital and being followed up carefully for several months afterwards.
So, Dr. Reid, when bone marrow transplants have to be considered, I guess you go through a series of treatments that don't quite work.
Up until that point, and we can almost predict that the transplant's going to be necessary based upon the type of leukemia at diagnosis and that initial response. The failure to have the initial remission with one course of chemotherapy, that's a bad sign. The prognosis for adult leukemias is not as favorable as the pediatric. As Dr. Greenberg said, the pediatric leukemias are genetically different and more responsive to therapy, but some children also need transplantation. So
you, and of course you had to go through all this with him, and through all these times on all these medicines and all these immune deficiencies that basically he was living with. He was a pretty susceptible puppy there, wasn't he?
Oh, yes. And, well, with the second round, actually, what happened was I guess I was very tired, too, having gone through everything. And we didn't really have... we weren't given great odds, and I'm not the optimist anyway. And so, frankly, what happened with the bone marrow transplant was that I, as the caregiver, wasn't really brought into the loop. I was needed. He couldn't have the transplant without a caregiver. But Ron kind of assumed this is my only chance, and so suddenly we were going out there, and I frankly thought he would die out there, and I didn't have any support systems out in Seattle. So it was very, very traumatic, very, very traumatic.
We had to drop everything in your life to go do this?
Yes,
Sure.
yes.
And how old were your kids at this time?
Well, the youngest one was a teenager, yes, teenager.
So you had to find somebody to take care of that child for a little while, too?
Master the home, and yeah.
Who was probably pretty
lockup.
confused about what was going on.
Oh, yes, there were a lot of spin-offs in the family. Of course, the whole family dynamic has changed greatly. And
now that you've been through it, I'm sure that there was a lot of resilience required, but you must have been really taxed emotionally, physically, and pretty angry at some point or another.
I was, yes, and I didn't feel as a caregiver that it was a level playing field. I didn't feel that I could express my emotions. And I remember once, it was actually the Leukemia Society hosted a caregivers dinner, and something went wrong with it in their PR, and so the patients showed up with the caregivers, and we landed up at this talking a lot about the illness again. And I found myself getting very angry about that, because those were places where before caregivers could share their things that maybe they couldn't say to other people, you know. And so that was, I remember just suddenly having this real anger and feeling this conflict about not being able to express it and so forth. And so caregiver groups have been, in Seattle, they were they were critical. They were critical to have like-minded people who could share the journey with you and even give you hints how to be a better caregiver, if nothing else.
How to cope.
How to cope.
Bone marrow transplants require a certain type of matching genetic marker for that to happen. Give us a sort of a perspective on what happens. I mean, do people donate bone marrow? Is it a painful process? Do they donate peripheral cells? I mean, I think there's a lot of confusion out there as to where these donor cells come from.
Yeah. It's a little bit more complicated than blood typing and matching a blood donation. You're doing, it's sort of like a tissue typing, and there are multiple different target, for lack of a better word, proteins on the surface of the lymphocytes that we're trying to match between donor and recipient. And the more brothers and sisters you have, if you're in a family of 8 kids, then statistically there may be a common pattern in tissue type. If you don't have a related donor, you have to go into the donor pool. So we have registries of people who've just donated 1 tube of blood, and their tissue type is done. It's put in a computer database so that when someone comes along with leukemia and they don't have a sibling or their siblings don't match, then we can go into that registry to find it. The donation historically began as a bone marrow aspiration, just like the diagnostic biopsy, which was 1 or 2 aspirations from the iliac bone back here. The donation was 20, 50, 100 aspirations, a general anesthetic procedure to be a donor. And then we found out that these stem cells in the bone marrow that can give rise to a whole new immune system, they actually circulate in the bloodstream. Now they can be collected in a way that's similar to how patients undergo dialysis. So it's become less painful to be a bone marrow donor.
So it's more or less like giving blood.
Right.
In the same context of a catheter.
Yes.
Just taking some blood.
And just to expand on that for a second, so the reason why it's so difficult, and Dr. Reid's talking about you need brothers or sisters, is each of us has a tissue type that reflects half our mother, half our father. So parents will not match their children for the most part. There are roughly 43,000 different tissue type combinations.
Wow.
Now, to make it a little easier to find a match, like Dr. Bastian went to one of the libraries of donors, we now also have cord blood banks. And we're able to obtain enough stem cells from the remaining blood left in the afterbirth, after a child is born, to actually perform a transplant on a small adult, certainly most children.
So, and I think that that's a hugely important feature to bring out. 2 things. One is that being a bone marrow donor doesn't involve having your bone poked and sucked anymore. The stories you heard about it being incredibly painful, which you guys have to go through repeatedly in the course of your disease. But people wanting to give something now just have to do it like they would if they were giving blood.
Right.
And then if you're delivering a baby, you can actually sign off on letting them harvest some of the umbilical artery blood, and they can use that as stem cells as well in transplants. Do they use it in the adult transplants as well?
Yes, and the cord blood is a little bit less picky about. See, unlike the transplant of a kidney,
right.
If you gave me your kidney, I'm going to reject it within minutes. If you gave me your kidney and put me on immunosuppressive therapy, I may keep it a few hours, few days. If we matched, I'm going to keep that for years, 15, 20 years. Well, the donation of the bone marrow, that's an immune system, wants to go in and attack the host. So we have to overcome those issues. The cord blood, you can have a little bit more mismatches with cord blood, and that cord blood will enter in the immune system and be accepted by the host better.
So you talk about this immune system that you're injecting into someone,
Right.
and it's like an alien then.
Right.
It's attacking them, and I guess you can develop a certain type of disease. They call it graft versus host, and I know that it's one of those things that seems to be always in check and never completely resolved.
Well, that's not an unfair statement. It may be indefinite. Having had an unmatched donor and an unrelated donor, I do have GVHD. And as a matter of fact, having had a pneumonia in last February, my graft decided it would pile up on my lungs too, and I had a very bad pneumonia requiring intubation. So this, in fact, does happen. Fortunately, medications can usually control it and can stabilize it. So even if it goes on for some indefinite period of time, you can still lead a fairly normal life, except keeping away from people who could be sick. It's a pretty significant part of that tall order that you want to be careful about.
So in the one hand, it's giving you an immune system. In the other hand, it's also got to be suppressed so that it makes you more susceptible.
Yeah, it's a balancing.
Fine balance.
Yeah, it's a balancing act. If they didn't rein it in at all, it would wipe out a good part of my internal organ systems. But if they rein it in too tightly, I'll be highly susceptible to any infection, which could just immediately do me in.
Right. But it doesn't sound like this is the kind of cancer that people run off looking for alternative forms of treatment too easily. Do you find that happens? I mean, let's say that certain types of in situ breast cancers, people will refuse the conventional radiation or chemotherapy or something of that nature. But with the leukemia, I don't think you could see that.
No, I mean, over-the-counter or some herbal medicine remedy.
Right.
Yeah, I think people recognize that mainstream science is the best way to go with treating leukemias.
Yeah. It sounds like it's a much more devastating and acute process.
Right.
But I do know that you had a bone marrow transplant, and you have to have some kind of very special feeling about the process. The donor, do you know the donor?
Well, not at first. Of course, I was just told that he was a 53-year-old man. Didn't know where he was. He could have been in Australia, for all I knew. I received his cells on that was July 3rd, 2002. And from that point, the clock starts, and a year needs to go by before the bone marrow coordinators will actually put you in personal contact if both parties agree.
Right.
Of course, that assumes that you survive. And so at my 1 year anniversary, I did ask to be connected to my donor, who agreed to communicate with me. We talked on the phone shortly after that and actually got together a couple of times. Nice little side note is his name is Sam Stedman of Clayton, New York. And when we had a son, we adopted a son a few months ago. There was no doubt what his name was going to be. So now we have Good Sam, Good Samaritan Sam in New York, and we have Baby Sam now.
So I guess that's a very inspiring story that you appreciated it that way, and it is an incredible gift of life.
Yes.
And
he, I had to ask him, how's it that you came to be a donor? He was already a blood donor anyhow, and one day a nurse at his collection center said, well, how about pay $15 or whatever it was and get on the bone marrow registry. And he said, what the heck? Well, he was my only possible donor. So that statement, what the heck, was the difference between me living and dying.
Wow.
It was almost an afterthought for him. He doesn't think himself any kind of a hero, but of course we in our family do. And we made sure that we got him down to our house as soon as we knew who he was and celebrated him and the way that he saved all of our lives.
So, it's interesting, you on your driver's license, you can always sign off on, I'll contribute my organs if, in fact, I'm dead. Right. And there's some sense of satisfaction, I guess, that way. But I can't understand why people wouldn't really be anxious and willing to give that gift of life to people and to feel that satisfaction that they could do something very positive. It's a very positive and wonderful thing. And there are other cells that people give. I mean, I'm sure there were times when you were anemic or that you didn't have any platelets.
Yes. Praise God for the platelet donors. They go through a lot just to donate enough for a person like me to receive 1 or 2 units. And frequently, the doctors prescribe that all platelets come from a single donor rather than mixing 2 different donors at the same time. And those people go through a lot to save lives, and I guess they're generally underappreciated.
Did your son have to get a number of transfusions?
Quite a few. Yeah. There was times when my wife and I would both have to take off work, and we would just take Jason, over there because he couldn't drive because of the chemo and the different medications he was on because of the pain.
Right.
So he went over there many times, and there are times when he has sat up at Fairfax Hospital because there wasn't enough platelets. They were saving them for the emergency patients.
Mm-hmm. So did it inspire you to donate blood?
I have donated blood. My wife is the big donator because she's the O negative.
Right.
And then when she had breast cancer, then they wouldn't take it anymore.
Sure. So you get inspired to do things to help people. Now you're a coach.
Yes,
you're a hockey coach.
Yes, it's scary.
And you're here to make sure that he doesn't say anything he shouldn't say.
That he keeps himself in order. Yeah.
That's right. Okay. Because we know hockey players are pretty wild guys.
Nice.
No boarding in here, right?
No boarding. No.
Okay.
No. Bank checking is allowed there.
Right. Has he convinced you to do some blood donations?
I'm not allowed to.
You're not allowed to?
In 2001, I was diagnosed with reflex sympathetic dystrophy. I was systemic stage 4. Went through my own form of chemo like they do with the people with MS and ALS. And I went down to 134 pounds, but I'm a hockey coach and nothing can kill me.
Right. You have your teeth, so you've done well.
Some of them.
And that's a pretty devastating disease to go through as well.
Yeah, it's one of the most painful diseases known to mankind. And I suffer from fibromyalgia. I have chronic pain, 24/7. I stutter now. Yeah. And a lot of the drugs like Neurontin and all the different things that they had to give me really did change some of the patterns that I have. I'm completely atrophic on the left side of my body and still coaching.
Yeah, well, you got to find something to keep yourself going. And that's important too. It's not an easy thing to find the kind of inspiration you need just to keep yourself moving along. Ron, I know that you have also had some pretty intense experiences going through this. And how has it changed you? What are some of the things that you went through that really gave you a different shade on the world?
Well, I think when a serious illness happens, it makes you see what's important in life. And it strips away some of the filters and distractions which keep us otherwise preoccupied. For me, it gave me a great appreciation for life, for beauty, for goodness. It made me very appreciative of all the people who cared for me. It really helped me to understand, and even now as I'm continuing to understand, my wife's commitment and her staying right by me, which without her support I could not be here today. I would not be alive. So it's really drawn me into relationships very deeply. It's increased the commitment and depth that I have in my Christian walk in life. And so it's been a very curious, unexpected source of some blessings that I wouldn't have otherwise had, nor would I have requested it to be done in this way.
I can imagine. We all have to have our trials and tribulations in one way or another. Have you found any incredible resources, or has it brought a different meaning of the world to you? I mean, you said you were a happy-go-lucky kid, and now you've been through this, and you've actually watched your brother go through what ultimately could be a more serious process than you went through.
Yeah, I mean, I think with anyone who has went through any kind of life-threatening illness, it really gives you a new appreciation for life, and pretty much like Ron said, any little thing that might have otherwise bothered you before, it's really nothing compared to when you really think, well, hey, I'm alive. Really, I mean, I don't get stressed out about anything now because, hey,
Right.
it can always be worse.
Right.
And
so traffic in Northern Virginia doesn't.
that still kind of gets.
All right, I knew it was something, right? Of course. But that's good. So, their revelations, and I know that support is a big thing. And Jason, you had some pretty interesting support. I know that we have, you were out there in the middle of nowhere.
Yeah.
You had no money to pay for care.
No.
You were in a pretty bad way.
Yeah, I've had support from family, friends, people I don't even know,
Right.
the hockey community.
Yeah, and they even did fundraisers for you. Is that
Yes,
right?
I've had a couple of fundraisers. I played roller hockey also,
Right.
and ice hockey. So our coach, Chuck Foster, he organized a roller hockey charity hockey game, and my best friend, Grady Little, organized a charity ice hockey game where we raised probably altogether between both about $20,000 or so.
So these things are all important. People come to your support. And Carl, you work with an organization. I know there are a number of organizations out there that are important for people with leukemia.
That's
Tell us
right.
a little bit about the Leukemia Lymphoma Society, or is it Lymphoma Leukemia Society?
It's the Leukemia and Lymphoma
Okay,
Society,
great.
and I'm
Okay, very good.
I'm on the I'm a volunteer. I'm on the board of trustees for the local chapter here in the National Capital area. And the mission of the society is really to cure blood cancer, to cure leukemia, lymphoma, and myeloma. But it's also to improve the quality of life for patients and their families, the caregivers. And that patient services prong of the mission is really critical. The Leukemia and Lymphoma Society, their goal, their objective is to have contact with at least 50% of the newly diagnosed patients within 30 days of the diagnosis, because they want to let folks know that there are resources out there. The society has several support programs ranging from support groups for patients, for caregivers like the one that you had mentioned out in Seattle, for healthcare professionals, just to give people a place where they can go. There's also a pretty interesting program that I think is probably a little underutilized actually, but it's called First Connect, where they connect a newly diagnosed patient with somebody who shares that diagnosis, and you can learn more about it.
We're going to have to refer people to the website, and they can find out about transplants and donating and all those kinds of things there as well. I want to thank Dr. Reid, Dr. Greenberg for being here with us. And I really want to thank you all for being here as well. It's been really instructive. I mean, these guys can offer something, but you guys offer an incredible amount of insight and experience. Anyway, I want to thank you for joining us, and until the next time, I'm Dr. Russell Libby, looking out for your health.